Hi guys, I'm Dr. Rashmi. I'm a dermatologist, and today's video I'm going to talk about hair fall associated with COVID-19. In the ambulatory dermatology clinic, there is increasingly apparent manifestation of hair fall and diffuse hair loss and COVID-19. There has certainly been increase in hair fall ever since the pandemic has started. Losing fistful of hair can give you so much of stress that you end up losing more. Why exactly does hair fall happen after COVID-19, and what exactly do you see? Whenever body is exposed to stressful situation like any kind of acute illness or acute infection with fever or post surgery or after delivery or any kind of other infection like typhoid, malaria, body tries to conserve its energy and shift its focus or energy to more life substantiating functions. Hence, your hair is deprived and you start to notice something which is clinically called as telogenic effluvium. Now, normally about 5% of your hair is in shedding phase, whereas in telogenic effluvium, what happens? 30% of hair enters, they get prematurely arrested and they enter this phase. So you end up losing more and more of hair. Now, when exactly do you start to notice this? This is typically seen after 3 months of COVID-19 infection. And how long does it last? It could last for about 6 to 9 months, and so there is no overnight magical remedy for this. What are the basic symptoms? You'll start to notice that every time you shampoo your hair or when you sleep, when you get up in the morning, you start to notice a lot of hair on your pillow or in the sink drain or shower drain. So these are basic things which you'll start to notice. In case you feel that it's getting too much for you to handle on your own, then you must visit your dermatologist or your treating physician. What are the small changes you should do when you're seeing that you're suffering from hair fall after COVID-19? You can do some little modification, like in terms which I'm going to tell you. Use a shampoo which is a milder shampoo. Don't use very harsh shampoo. Don't plan any chemical treatment or minimize your heat exposure to your hair. Let your hair air dry. Also, don't overzealously comb your hair. Use a wide tooth comb, and immediately when you shampoo, don't comb your hair just after you have shampooed. At least wait for it to air dry and then comb your hair. Oiling. Now, oiling is another trend which you feel that when you're losing hair, oiling your scalp or oiling your length of the hair can help you gain more hair suddenly. No, this does not happen. What you should do is you can oil, but oiling frequency has to be not more than once in 10 days, and you must concentrate on oiling on the length of the scalp, on the length of the hair, and on the scalp the massaging has to be done very, very, very gently. It should not be a vigorous massaging because then you will end up losing more hair. Apart from that, you must take care of your diet. If you were thinking of losing some weight after COVID-19, this is not the right time to do all that. Have a healthy balanced meat, which means you have to take appropriate amount of carbohydrate, fat and protein, and superfood for hair. I'm going to be talking about superfood for hair in my next video. Also, you must indulge in taking multiple supplements, like you can take antioxidants, which can be beta carotene, which can be vitamin C, vitamin E. Also include like hair supplements like biotin. The role of biotin has also been proven. You can also take calcium and vitamin 3. Taking all these supplements can really help you restore your health and also health of your hair. Now, apart from that, indulge into regular exercise and keeping yourself fit. And indulging into exercise, actually you will be releasing happy hormones which will de-stress you, because stress itself is a very important factor for hair loss. So keep following all these little things, and in case still you are having difficulty to solve this, you must consult your dermatologist or your healthcare physician. Stay tuned for more such educative videos. Thank you.